Hey guys, Dr. Torado, your West New York chiropractor. And today we're talking about neck pain in children. You know, children have been treated by chiropractors for spinal problems ever since chiropractic was founded back in 1895. And neck pain is absolutely no exception. You know, neck pain is surprisingly very common in kids and even little kids. And though it's not as common as it is in adults, yet it would, I'm sure that you'd be surprised to know that there's actually a high prevalence of neck pain in kids all over the country and all over the world. And some of the causes of neck pain are very unique for children, and other causes can act actually as a serious warning signal for signs of something that might actually be a little bit more dangerous, such as, let's say, meningitis that could be taking place inside the body. But for more commonly, but far more commonly, neck pain usually in kids is not that dangerous at all. You know, looking at some of the studies of neck pain and shoulder pain in high school and middle-aged students, more than about 2 out of every 5 students suffer with some type of recurrent neck and maybe shoulder pain more than once a week. Now that's a whole lot, right? But think about all these backpacks and what these kids are carrying, all the books that kids are carrying every single day. I know my children are carrying heavy books to go back and forth to school. You know, studies also report that students' average sitting time during the day is about 10 and a half hours. I mean, think about that. That's a lot of kids that don't even sit up straight sitting for 10 hours. And students with a recurring pain or in their neck and shoulders also report frequent fatigue. They get tired very easy, and some of them even it results in depression and depressed moods. You know, looking specifically at around 1,100 kids, some of these studies showing kids using backpacks, it shows about 74% of the kids were classified as having back or neck pain. When compared to some of these kids that don't use these backpacks, there was nearly a 2 times greater likelihood of having back or neck pain. I mean, that's a lot. You know, another common cause of neck pain in little children is also a condition called torticollis. It sounds like a turtle, right? But it's called torticollis, and some people call that a wry neck. And this is basically when the muscles of the neck inside here in the back and also in the front, muscles that help rotate the head and extend the head from a normal position, often get described as being stuck or very tight in this position. And though there are several types of different types of torticollis that occur inside the neck, it can also be triggered by almost anything, including, let's say, just a dramatic change in weather. Recently, it was warm just a week or two ago, and now it's actually really cold. Sometimes sleeping in a room that has a drafty window can cause torticollis, or even sometimes following an infection like a cold or flu, or even sometimes maintaining bad posture for a long period of time, which is really common in some of these teenagers that I see walking around my office all day long. You know, even certain types of medications and a lot of others can cause torticollis inside the neck. Some studies even describe torticollis as usually improving within, let's say, 2 to 4 weeks under medical supervision. But in the hands, or what I typically see inside the office whenever someone comes in with torticollis is it usually only takes about 2 to 3 days for the acute pain to actually subside, and maybe up to a week to actually finish off the job so that these children actually feel great and can move their neck back and forth all over again. Of course, that's going to vary depending upon the case, but even infants can be born with a congenital type of torticollis where they don't even move their neck. And that sometimes occurs in like 0.3 to 2% of newborn babies. And here too, even with these newborn babies, you may not think about it, but here too, chiropractic can be very effective in taking care of these newborn babies that are born with torticollis. I mean, think about it. What are you going to do? Give the baby a handful of medication? You just can't do that. So, whatever it is that you decide to do when your child has neck pain, I just always want you to remember, think of it this way: safe, gentle chiropractic before doing needles or surgery. I mean, it may sound like it's common sense, but to some people, they're quick to take a child to needles, or they're quick to bring their kid to a surgeon, when sometimes safe chiropractic manipulation can be a great choice. And if I can be of any help, just reach out and give me a call. This is your West New York chiropractor. And if you like this video, before I forget, just press like at the bottom of this video, or press subscribe. And my videos that come out, my brand new videos, will be sent over to you as a reminder. Anytime I decide to put up a new video, it'll go straight to your email. That's it for today. I'll talk to you soon.